Ms. Cammack for her 5 minutes of questions.
Thank you, Mr. Chairman, and thank you to our witnesses. This has been an interesting conversation today, an important one, but some interesting commentary that's popped up along the way. Now, of course, for the more than 68 million Americans who rely on Medicare, including over 5 million in the Sunshine State, Florida, for those of you unaware what the Sunshine State is, timely access to innovative medical technologies is critical. So whether it's early cancer detection, breakthrough devices, or better management of diabetes, these tools can save lives and improve quality of life. Yet too often, and we've seen this time and time again, CMS, they're slow, they're confusing, and many of the processes are arbitrary. Patients are left waiting years for access to technologies that have already been cleared by FDA. The red tape doesn't just stifle innovation, it denies seniors the care they need when they need it most. Now, as policymakers, our responsibility is to make sure that Medicare serves patients, not the bureaucracy. And that means transparency in coverage decisions, accountability at CMS, and removing barriers that stand between seniors and life-saving innovations. And as I said, I've appreciated today's conversation, but most importantly, I'm looking forward to working with my colleagues to advance common sense reforms. And I know that common sense isn't common here on Capitol Hill, but we're working through that. And we want to support innovation and ensure that seniors, not just in Florida, but across the country, have access to the very best care. So I'm going to start with you, Dr. Britton. You mentioned the reviews and duplicative systems, the burdensome requirements over at CMS. Can you give one or two concrete, very specific examples where the red tape wasted time and money without improving outcomes?
Yeah, I think the best example I can say is currently the national coverage decision for TAVR, which has been demonstrated to be a triple win. Obviously, mortality benefit, reduction in cost, quality of life improvement, and yet because of restrictions now, basically it's not available to all potential Medicare beneficiaries.
Right.
It's not available because the restrictions are that it has to be done in certain centers that are large enough. It's typically not in the vulnerable communities that it's available to because that's the restrictions. Based on the original idea in 2012 when we rolled it out, that we wanted to start slow. We wanted to roll it out slowly and find out who would benefit from it. But we're kind of past that point.
Yeah.
So now we're actually sitting here in 2025 and we're living with the same thing we were talking about in 2012 with a mild revision in 2019.
Okay, is there another example you can cite?
Another example I can cite of
Just red tape and the delays, specific concrete examples on CMS specifically.
I think that CMS, first of all, CMS has been, to the best of their ability, a partner for us. I mean, we've worked with them very, very closely. Yes, there are problems with CMS, no doubt about it, but they've been a very good partner. They've been very transparent to the process. I would say probably the best example I can give you is that we went through this TSET pilot, and although we wanted to actually have coverage immediately, that was the intention. It was 13 months from authorization to ultimately national coverage decision when a plan could have been done earlier for using CED for that coverage.
Absolutely. And I'm going to kick it to you, Doctor, or to Mr. Ezell. You've warned about China racing ahead in multi-cancer early detection and other technologies. So if CMS keeps dragging its feet on this, do you believe that American innovators will take their research and investment overseas? We've, of course, seen the challenges and some of the outcomes where that's happened before, but that ultimately would leave our seniors here in the U.S. waiting while other countries move ahead.
Absolutely. This is a rapidly innovating global field. There are competitors in Europe. There are at least a half dozen competitors in China. It's important that the United States continue to be at this forefront of the MCED field, which we were the ones to pioneer and create. And Congress, by creating this pathway, can send an important signal to innovators that this is an industry ripe for innovation.
Well, and I'll just piggyback on that, bring it back home. We know that innovation and leading is important in this space, but we also have people falling behind here at home in rural America. And there's a lot of attention that gets drawn to the urban centers in major cities, but rural America is hurting in more ways than one. So how can we, and especially in a district like mine, where my seniors are in predominantly rural areas, how do we make sure that the breakthrough technologies that we've invested so much in are actually making it to these areas? Because what we've seen is the rural hospitals, they're behind on getting this type of technology for the people that they're designed to serve.
So in the UK, the National Health Service is doing a test of Grail's Gallo-Rice system. And what they've done is deployed mobile phlebotomists out across the entire UK to go into rural communities and do the blood draw, which the MSED relies on. And it's a more accessible, less invasive type of cancer detection. And it is really poised to help us address this issue that cancer rates in America's rural communities are 14% higher than in urban areas. By the way, I just wanted to note that Professor Otis Bradley at Johns Hopkins University points out that for a woman detected with breast cancer, her 5-year fatality rate is twice what it is in Mississippi than Massachusetts.
Yes.
And the issue of access to leading health care is real in the United States, and MSED can help us address that challenge.
No, and I appreciate the grace that the chairman has given us, and we're very far over our time. But thank you for mentioning the mobile clinics, and that is exactly why we need to deploy mobile clinics in every congressional district for screening for women's health care. So thank you for that.
And the gentlelady yields back, and I think